recording. Welcome everyone to today's Prevent Connect web conference, Bystander Intervention, Building the Evidence Base for Sexual and Domestic Violence Prevention. Prevent Connect is a national project of the California Coalition Against Sexual Assault, sponsored by the U.S. Centers for Disease Control and Prevention. The views and information provided in this web conference do not necessarily represent the official views of the United States government, the CDC, or CalCASA. It is a pleasure to see so many people joining us from all over the country for this very important topic as we are talking about how we can build the evidence. And this study that recently came out, I think, is really makes an important contribution for lessons for all of us in doing our prevention work, and that's what we're going to be able to explore today. So it's so great to see so many of you joining us throughout the country. The objectives of what we want to accomplish today is we want people to be able to assess, participants to be able to assess the value of bystander intervention programs, and then to be able to describe the outcomes of the green dot across the bluegrass study that we'll be talking about today, and then identify the implications from the study findings and how they can be applied to current bystander intervention and prevention work. And so we want to be able to use this. We know that research tells a specific story about what was studied, but there's also a lot of information that we think is relevant for us to think about in our prevention work. So we're really excited to be able to have that. So this all stems from an article that has the catchy title of RCT, which is Randomized Clinical Trial, Testing Bystander Effectiveness to Reduce Violence, and this appeared recently in the American Journal of Preventive Medicine. And so we do have a link to it, and this is available online at no cost, so you can all be able to get that. Meghna just put the link, so if you wanted to be able to get a copy of that. So this is the article. I want to get a little bit of how many of you have actually looked at this article? So let's go in the left-hand corner. There's a yes, no. And go ahead and let me know. How many of you have actually looked at the article? And so this is an article. I know that you're all aware of it because you knew that you signed up for the web conference, but how many of you had a chance to look at this article? And so go ahead and keep on voting, and I still know that I have 1/3 of you have not voted yet. But the results are getting clear here, so I'm going to go share the results. And you can see that only 16% of you have looked at the article, and the other 84% of you will be looking at it soon. So that's my framing, my positive framing here. And so great, I really do encourage it. We're obviously reviewing the findings here. It is an academic article, but I think it's written in a pretty accessible academic article, and so I want to encourage you to do that, and we do have the links that are available. We will be reviewing the findings. So I'm going to withdraw that question right now. And so to do this, we have a very large panel, and I'm very excited to have so many people here to join it. So we are joined by Ann Coker from the University of Kentucky. Hi, Ann. How are you doing today?
Hey.
Great to have you joining us from all the way in Kentucky. And you are joined with your colleague, Heather Bush. Hi, Heather.
Hi.
Hi, and then to continue the Kentucky theme, I'm really happy to have Eileen I'm going to mispronounce your last name, I'm sure, Reckendwall from the Kentucky Association of Sexual Assault Programs. Hi, Eileen.
Hey, David.
Hi, great to have you here, and this has actually been a conversation that I've been having with, as this research has been going on with the authors, and great to have you. And we also have Kristen Parks, who is currently working at Green Dot, etc., Inc., but also in the past was one of the implementers who was actually implementing in this study, implementing Green Dot at a local program in Kentucky for this program. So how you doing, Kristen?
Doing good. Good morning and afternoon to everybody.
Thank you so much for joining us. And just so we can go a little bit out of Kentucky, we have, I'm really pleased to have Mo Lewis, and she is with the National Sexual Violence Resource Center and is one of the great prevention resource people over at the National Sexual Violence Resource Center. And Mo, you're in Seattle today, right?
I am. Hi, David. Hi, everybody.
Great. So we've got Kentucky and the West Coast well represented here. Thank you all. And so we have a whole lot of presenters, and we're going to be going back and forth amongst all of them. And we're really pleased to be able to have so many of you being able to join us today for this. So let's start though with a question for our audience. And so I want to get a sense from your audience of describe, from your perspective, how is bystander intervention helpful in sexual and domestic violence prevention? You know, it used to be years ago we had to define what it was, but I think a lot of people here are very familiar with it. But I'd love to get a sense of, just describe in the text chat how bystander intervention is helpful in sexual and domestic violence prevention work. And it started about changing the culture, it can support victims, it engages society in addressing the problem, it empowers bystanders to be active and involved, it helps folks see their role in prevention, and now people are running in quickly. It meets people where there are, involves the public, everyone can get involved, it expands responsibility, it's a model by example. We can take the blame off victims. We can make sexual violence a public issue. It's very helpful because it gives people examples of what to do. We can change social norms to lower the tolerance of sexual violence. It helps reduce the stigma of sexual violence. It does not paint men as perpetrators, women as victims, but highlights people as being perpetrator. It creates a culture of accountability and care. It can stop victim blaming. Its involvement in society. I know it's a lot of theme. It keeps us from telling boys they're all rapists, which is so awful. It can reduce apathy. It can bring accountability. It allows the dialogue to begin. It shows people that they can make a difference in their communities. It involves society to see. It takes all of us to be able to end victim blaming, move from victim blaming to empowering victim. And it empowers individuals and victims. And society can work together. And it's a way that we can also engage men and boys. So great. It's a great theme. So many people talk about how bystander intervention can work and make a difference in our prevention efforts. And I've often seen the bystander intervention as being an approach that is not just looking at people as potential victims or potential perpetrators, but looking at everyone as being potential bystanders who can take action to create change. So Anne, why don't you talk about, briefly, it looks like your picture, oh, there you are. So, Anne, can you just describe a little bit of sort of the background of bystander role in violence prevention?
Sure, I'm happy to. I want to say how happy I am to be on this call because our team from Kentucky, we're spread out. We're not all in the same room, but we've been doing this work for almost 10 years. Barack Obama was just elected when we started talking about this, and here we are on to another president. But actually, I feel like my work is already done because a lot of the comments, David, that you were reading are exactly what I would have said. So we know that in the mid-1990s, due to a lot of the great work that Jackson Katz and others have done, really infused violence prevention with men as being a big part and an important part of shifting our conversation so that men were very involved in or became more involved in violence prevention or sexual violence and dating violence prevention. So that was the beginning, essentially, of bringing the bystander role into violence prevention, and then the great work of Vicki Banyard and her group in the middle of the 2000s and really focusing on specifically sexual violence. So I was asked to briefly talk about the premise, and the premise for the bystander role in violence prevention is what I'm asked to talk about, but it's also really what are our hypotheses in terms of how the program that we're evaluating, that is the Green Dot program, how it is hypothesized to actually affect the ultimate outcome, which we're measuring of violence, sexual violence in particular, and specifically reduction of sexual violence perpetration. So the real question is, how does the program shift or change social norms? The social norm we're focusing on is violence acceptance, and we're measuring it, or we measured it as sexual violence acceptance as well as dating violence acceptance. We also wanted to, in our intervention, which is different than some other interventions because we're including young men and women, girls and boys in this particular high school intervention, so it's involving both sexes, and looking at those norms that may support violence and framing that interaction around that environmental support, if you want to look at it that way. The last issue is that of reframing violence as engaging men and women in the prevention efforts. So it's not just in terms of disrupting a situation that might be violent, but also doing preventive behaviors that aren't exactly in the context of a specific event. What we're interested in evaluating is changing norms, which is the first component I mentioned, as well as changing bystander behaviors, which we measure as the actual engaging bystanding from the perspective of intervention as well as that of prevention behaviors.
Thank you, Ann. So, that's the premise there, and then that's led to this work with in Kansas. And so, Eileen, why don't you take it and talk about why? So, there's many bystander programs. The one in particular that we're looking at in this study is the Green Dot program. And so, why Green Dot in Kentucky? Eileen, why don't you tell a little bit of that story?
Okay, we found ourselves in Kentucky in a similar situation to a lot of states. We were using rape prevention education money, which is funding that we get from the CDC, but it's also a Violence Against Women Act pot of money. The allowable uses for the money changed in 1994 to be used only for primary prevention. At the time, we were using it for hotlines and advocacy, and most other states were too, I believe. So one of the requirements to begin to look at primary prevention programming was to develop a state prevention team. We did that here in Kentucky, and we invited Dr. Edwards, Dorothy Edwards, who is the author of Green Dot, because we had everyone on the state prevention team was an expert in some sort of prevention, primary prevention of public health issues. And we had not previously thought about sexual violence as a public health issue. So we asked Dr. Edwards to come and sit on the prevention team. She did that. One of the other requirements for the rape prevention education money was that we were to develop a strategy, and the state prevention team was responsible for choosing a strategy that was science-based. However, in Kentucky, and I don't think anywhere else either, was one available. There weren't any that were proven. At the time, we were expected to have a proven science-based strategy. So Dr. Edwards presented Green Dot at the state prevention team, and it had already been in use for a year at the University of Kentucky, and it had pretty good data for effectiveness with the college population. Well, the rape crisis centers, who are the ones that actually did this RCT with our research partners, had a better relationship with high schools, and we felt like that population was really where we wanted to start. We wanted to start earlier than college because we felt like those young people were starting to date at that time, and we wanted them to have the bystander intervention strategies and skill sets available to them. So Public Health introduced us to our partners in the University of Kentucky, which is my alma mater, and it went from there. They applied for a grant, and we helped them with the design and with the data collection, and it was a beautiful thing. So the next slide tells you about who everyone is that's on this call and how the research partners were together. And so there's quite a few of us, and CDC was a partner with us as well.
And I just, Eileen, I noticed that Sarah Dickey was actually on the call from CDC.
Yeah, I saw her. Hi, Sarah. Okay.
So this is Ann. I wanted to also mention that Dr. Rechtenwald received her doctorate as part of her work. It's an honorary doctorate from the University of Kentucky.
I did.
So it was very exciting.
It is.
So why don't we talk a little bit about what a Green Dot is, and I think, Kristen, you're going to talk a little bit about sort of what Green Dot is.
Yeah, absolutely. And it feels a little nerve-wracking because I've seen several people on this call who are Green Dot implementers on there, and I know that I trained y'all to do a 90-second overview of Green Dot, and it always feels a little intimidating when it's my turn to do it in 90 seconds to quickly try to explain the metaphor. And so fundamentally, what Green Dot is grounded in each of our strategies, and especially the high school strategy, is this metaphor of kind of imagining a map of your community, of your school, your college, or military base, wherever you live and work, and imagine that on that map are all of these little red dots that are popping up. And each one of these red dots represents a moment, just a moment in time, when somebody uses their words, their choices, their actions, or behaviors to contribute to what we call power-based personal violence in some way. And so a red dot is literally the 2 seconds that it takes for somebody to raise their hand and backhand their partner, or the moment that it takes for a student to make the decision that they're going to tweet something or send something on Snapchat that makes fun of or bullies or mocks another student. It's the series of decisions that somebody makes to show up outside their ex's home and their job and their car and their football practices, even after being asked to stop. They're just these individual moments that collectively have added up to something much, much bigger, where we know that across high schools, across our country, there are way too many students who are experiencing things like bullying and dating violence and sexual assault. And if we want to begin to shift and change that, we have to think about what the choices and decisions that we as individuals are making. So imagine, again, in the middle of that map is a green dot. Now, a green dot, again, is a choice. It's just a moment. But it's where you or I as bystanders, we make decisions to help look out for and keep other people safe. So if I'm in the halls in my high school and I see a student who is being picked on or made fun of, and I go over and tell the people who are doing it to stop, that it's not okay what they're doing. The 2 minutes it takes for me to have that conversation with them, that puts a green dot on the map. Or if I go and tell a school counselor or the principal or a teacher that I trust, hey, something's going on with my friends, they're in this new relationship and something about it doesn't seem okay, will you check on them? That puts a green dot on the map. Or maybe a green dot is I create a diversion or a distraction of some kind. I see a couple arguing and it sounds like it's escalating and I'm getting that feeling in my gut something's not right. And so I just go over and say, hey, did y'all see that funny video on YouTube? And I pull it up on my phone and try to get them to kind of de-escalate where they are right then, or I ask for directions, or I tell them the teacher's looking for them, but do something to disrupt the situation. And ultimately what the goal is, what everything within the strategy boils down to is, if we can have more green dots on our map, metaphorically, than red, then we will see the rates of violence go down. When more people are making decisions and actions that help keep other people safe, then we will see less people getting hurt. So fundamentally, everything kind of boils down to that as the basic metaphor. And I'll stop there. I think I did it in a minute. 60 seconds. Bam.
Good job, Kristen.
Thank you. Thanks for the positive reinforcement. I think it was.
All right. So in this particular intervention, there were two phases, and Eileen and Kristen, do you want to explain what these two phases were of what the intervention is?
Go ahead, Kristen.
Sure. So there were, as David said, there were two phases when we were implementing this in schools. The first part were our green dot persuasive speeches or overview talks, and ideally the entire school population would be exposed to those. And if I remember correctly, Eileen, I think most, if not all of us, accomplished that goal in terms of reaching saturation, where
yep.
most of our schools were exposed to this speech. And it's about 45 to 60 minutes in length. You could do it in about 30 minutes if you needed to. And some were done in really small groups, some larger groups. Ideally, the group would not be bigger than 50 students because you wanted to still keep it small enough where you felt like you were really engaging with most of your students. We did those in a variety of different ways. I know for myself, I got access to a lot of the health classes, also some science classes as well. English classes was a way for me to access students. Other instructors, they might have done it like either right before school or right after. They also might have had different classes that they had access to, or they did it for different organizations like student clubs to get exposed to as many different students as possible. Then the second piece was this peer or popular opinion leader bystander training. So this was for a targeted specific subset of students within the population. We used the diffusion of innovation theory by Everett Rogers as the basis for why we did this, which if people have questions about that, certainly I'm happy to answer any of those. But that theory helps us decide on who the students are that we target for these bystander trainings. The bystander training is 5 to 6 hours in length, so it was essentially a whole school day. Sometimes we broke it up, like I know I did both, so I would do it either all in one day, or I might do 3 2-hour sessions broken up over several days. Sometimes we tried to do it on weekends or did it when school was out of session. We did find that it was more effective, at least on our end and for the schools, if we could do it during an actual school day. So we tried and worked really hard to make sure that that could happen as much as possible. These students who are identified are essentially your social leaders. So the students within your school who have a lot of social capital, and we wanted to make sure that we were getting those students across subgroups. The default can be, like one of the potential fallacies in using this is going, oh, okay, then I just get all of my, if you will, stereotypically popular kids. And while certainly those kids do have a lot of influence, there's also students with lots of influence across the different subgroups. So while maybe some of my stereotypically popular kids, like they have influence within their peer groups, they may not have influence across every single group in the school. And so we work to identify subgroups across our school population, and then within those groups, who are the students who essentially kind of everyone else in that group looks up to. So ideally, your training room should look like a cross-section of your school demographically, like who all makes up your school population, what are the different groups that make up your school population, and your training room should look like a cross-section of that. And so that was how we identified the students who went through those training, and so they went through a kind of a more intensive, longer training. And so those were the two phases that we had in our implementation, with the goal of ultimately school saturation.
Okay, great. Well, thank you for sharing, Kristen. So now, Eileen and Ann, you're going to talk about that. Led to this study, the 5-year study, and so Ann, do you want to, or Eileen, do you want to start, and then Ann make a few comments about it?
I can give you a little bit of context about why we were able to do this. Kentucky has about 4 million people, and we have a very large number of counties in Kentucky, 120 counties. So the way that we're structured is that our rape crisis centers, even though we have 120 counties, we only have 13 rape crisis centers. But the expectation is that they will cover their region. This state is broken out into area development districts. There's a couple of other states similar to us, especially in the South. It was designed for economic development, but it works really well also for service delivery. So that way we were able to randomize because we could, within one area development district, some of them have somewhere between 10 and 17 counties. We could have 2 schools in the same region, but far away from each other, so we didn't contaminate the control school. So that's why we were able to do the randomized control trial the way we were. Our infrastructure loaned itself to us, and it was beautiful because that's how we get access across the state with service delivery, and that also was very conducive to doing a randomized control trial. So for those of you out there wondering how in the heck did we do a controlled trial and not contaminate the control school, that's how. So now it's your turn, Ann.
All right, thank you. So I want to give a shout out to KSAP and the PIC team because they really designed this. We professors at the University of Kentucky really we lucked into a great situation, largely because of the work that Eileen, Dr. Rexenwald has done. So as you mentioned, the structure of KSAP does allow for then randomization within the region. So all of the regions, the people like Kristen across the state were responsible for identifying at least 2 schools per region that would be willing to sign a memorandum of understanding. I'm getting a little ahead of us. But basically we had an ability to randomize at least 2 schools, one to the intervention and the other to, which is the green dot, the other to a delayed, or in other words, a waitlisted control. So the promise was that the controls would stay with us for the 5 years of the trial, and at the point that we knew that the intervention worked, then we have a special offer, which we'll talk about in just a bit. So we did data collection every spring. We invited every student that could provide consent in the 26 schools every spring from 2010, which is the baseline, through the spring of 2014. That was many, and we went to every school. That was a lot of traveling, and we got to know our state really quite well in that time period. We joke about no one in their right mind would do this study again. I'm still convinced that is the case, but it was really the only way to get the comprehensive information that we had. Now, I'm saying this because we had a lot of students who participated. In fact, you'll see later, almost 90,000 surveys that were completed. However, our response, our sample size was only 26. So it's a lot of work for 26. I'm sitting right next to the statistician here. She's shaking her head. All right. So what we are doing here is really focusing on the school level analysis. So that's why I mentioned the sample size is 26. So we have 13 intervention and 13 waitlisted control schools. The primary question we're trying to ask, and this came directly from the Centers for Disease Control and Prevention, they wanted to know, does this program, the green dot across the bluegrass, the green dot program, as it was modified for a high school population, does it work to, and get this, specifically reduce sexual violence perpetration in boys and girls, young women and men, in the intervention relative to the control schools as they're followed or measured each year for 5 years?
By the way, Kentucky is called the Bluegrass State. That's why we named the trial across the bluegrass.
So here, Eileen, you were talking about your 13 your regions, and so here is indeed a detailed Kentucky map.
Right. So there are actually 15 area development districts, and 2 of the programs provide services in 2 area development districts, and they get more funding for doing that. So that's how our service delivery is set up, and we chose 2 schools, randomized 2 schools per region.
Okay, great. So this next slide actually is is a really important one because it sort of talks about how you see bystander effects taking place. And so I see this is Eileen and Ann are going to comment on this hypothesis about how to create change.
All right, I'll just go ahead, Eileen.
Go ahead, you go.
Okay, this happens a lot. So I actually kind of set us up for this a little bit earlier in talking about how we hypothesized that the Green Dot program would have effects in terms of first changing the individual's social norms. We measured it as violence acceptance. So that's the top of this pyramid, and we're measuring that in the program participants. Now, as Kristen mentioned, this is an intervention that we hope that it's diffused from the individual who gets training to their social network and ultimately to the school at large. So I hope I made a big deal that we're doing the analysis at the school level, not at the individual level, because we really hypothesize and believe that the intervention cannot really, in terms of violence, can't be measured only at the individual level. For example, I could be a very active and engaged bystander and get myself into trouble. That's not what you're supposed to do with the green dot, but it could happen. So my rates of violence or my experience of violence may not be reflective of how well the intervention works at the school level. So we're really focusing on what's happening at the school level, not necessarily in the individual's training, who is trained. So that's why we start with the program participant, and we're looking at the changes in social norms, again, measuring violence acceptance. We're also looking at their individual's engagement through their network, and the ultimate question then is, over time, do we see changes in the intervention relative to the control schools in terms of their rates? Primary question here was sexual violence perpetration.
And I want to just emphasize, this is so important to me from a prevention perspective, is that and one of the things that really impresses me about this study is that by looking at the school rate, while we're and using the school as the unit of analysis, what we're doing is really thinking about how we create community-level change. And so this is really exciting to be able to think about how does it do that and realize that there's pieces about the individuals, but our goal is to change that community piece. And now this has found a way to try to measure that within the school-wide level. So to me, that's really an important piece about what we're doing. Or what you did, not we. I was not part of it other than here. And so there are many different design and implementation issues that had come up. And do you want to comment about this?
I would actually like our program coordinator, Emily Clear, to talk about it, because she did the heavy lifting to make sure that this worked, and it worked beautifully.
Great. I don't have Emily's picture here, but hi, Emily.
Hi. So I was asked to quickly discuss some of the design. So it was a 99-item paper and pencil survey that was completely anonymous. We obtained a certificate of confidentiality for the study from NIH. The project had IRB approval for passive parental consent, which is very similar to the structure of CDC's Youth Risk Behavior Surveillance System. And annually, we snail mailed over 30,000 letters to parents of all students enrolled at the participating high schools. Our campus mail office loved us. The letter included a brief description of the survey and gave parents the opportunity to contact us and opt their child out of participating in the survey. This was less than 0.5%. And at the time of survey administration, students were also given the opportunity to opt out of participating and asked to bubble in a specific letter on their Scantron sheet. And that was just an attempt for us to keep them occupied and quiet while others took the survey. The slide here says UK team, but I'd like to interject that UK team, along with Rape Crisis Center educators, surveyed students from the end of January through May of each spring semester. And there were two modes of survey administration. The first was pairing research staff with teachers throughout the day and surveying students in the classroom all day. So they would pair up with an English teacher and just survey all students each period. And the second was a solution for administrator concerns about taking away teaching time. So we packed materials for every single classroom in the school, and all students took it at the same time during one period. So proctoring instructions were either read over the intercom, very similar to what I'm doing right now, or shown via DVD. So this was so that all students had the same instructions. So now that you know how we collected the data, Heather's going to talk through the flow of participants.
So this is a somewhat busy consort diagram, but it really just reemphasizes the point that had been made by several in the panel, that what was randomized here were the high schools. So the students did participate. There was a heavy student involvement. We had an overall student refusal rate of only 14%. Emily mentioned the parent refusal rate. That was less than 1%. And so we had many students who were participating. Even though we only had 26 schools in total, you can see across the years we essentially had the entire student body participating, which allows the estimates that we come up with where each school has the surveys from all the students summarized or aggregated so that the numbers represent the school. Basically, we did a census. So when we talk about a school-level analysis, we're using the student responses to describe that school.
Okay, Heather, and then go ahead, Heather, or Eileen. Actually, you were going to talk about the question.
Actually, we wanted to make sure that green dot training was implemented. So we we asked a couple of types of questions like, have you ever heard of Green Dot before? And this was just at the time when the Green Dot credit card was available. And so, you know, we were like, which Green Dot were you talking about? We wanted to make sure that actually everybody got the training, and the stats showed that they did.
Okay, and then Heather, do you want to talk a little bit about that?
Sure. So, you know, this is a randomized trial. It's not like a drug trial, though, where we can inject someone in the arm and all of a sudden they are part of the intervention or the control. Trainings happen over time. And so what you see here, the green dots are the intervention schools. And at baseline, we really had no students receiving the training. These are student reports of the green dot speeches they received. But each year you see more and more speeches happening. You'll also notice that there are some control group schools that indicated that they received speeches. This could be the green dot credit card effect. It could be other things, but you know, these are the student reports of what they had, but you can see that they're minimal. Yes, and there was this, as was mentioned, there were different phases, but there was also phased implementation. One of the things I'm going to mention is that you can see here in the poll training that there is a steady incline in the number of polls that were trained. So these are those who got the intensive bystander training. So really it wasn't until year 3 or 4, the very end of the study, that we actually reached that point of saturation. Both Kristen and Ann mentioned how this was a diffusion type of an intervention. That means that you have to have enough people who've been trained in order for that intervention to get diffused. And that takes time. And so it's not a shot in the arm. It is a process of getting students trained.
This is Eileen. I want to make sure everybody out there knows poll is the term that we use during the research. It means popular opinion leader. I believe Dr. Edwards uses early adopter at this point. It's exactly the same thing.
And
right, and that was the 5-hour, that was the phase 2 in a 5-hour bystander training for popular opinion leaders.
Correct.
Right. And our goal was to get around 10 to 15% trained. And so you can see that we didn't get to that point until the very last 2 years of the study.
Okay, then, so the next piece, so the findings were, as you just described, that indeed green dot training was implemented for both the speeches and the bystander apprehension. So then the second question was,
does the randomization work? And so if we look at the next slide, we will see that really in all characteristics, the schools were very similar in the intervention and control, which is what you would hope. If schools are randomly selected to be the intervention versus control, we would expect that the schools would be somewhat similar.
All right, so this is Ann. The next slide is one that worries CDC somewhat, because we are actually, we think about the range of different outcomes that we are looking at. As directed by CDC, our outcome was that of sexual violence perpetration. That was how we measured whether this intervention worked. But we know that types of violence are highly correlated. And so we had the opportunity, as Emily said, to ask 99 questions. We held back and did not ask 100. We could have. But we looked at then the whole range of, from bullying. We had 2 questions on bullying. We had questions on sexual harassment, intimate partner violence. We measured both psychological as well as physical violence, and we measured stalking behaviors, not specifically in a dating relationship and in a dating relationship, and then sexual violence, as I mentioned. We did a lot of work to adopt the language from tools that are well validated, but they're not necessarily so in a high school population. So we did a lot of work along that line. We also adapted some of the questions to make sure that we are including questions on both perpetration, because CDC asked us to do that, as well as victimization. So the point of this slide is to show you that we're not just focusing on sexual violence. However, our conversation here is going to be restricted because we don't have 3 hours to talk about it.
and there was a question about, and you started to answer the question here about, you had to focus on both perpetration and victimization. Can you talk about why it was important to have the focus on the perpetration piece of that?
The original, thank you, that's a great question. That was the call, the CDC grant call was really focused on sexual violence perpetration. And so that was our primary question, and that's what we included in our clinicaltrials.gov as our primary question. Be careful what you identify on your clinicaltrials.gov for a clinical trial, because that's going to be all you can really focus on when you're writing up your first paper. So that was really part of what was requested and what we included, and we wrote the grant to focus on that. But we also have secondary aims, and the secondary aim actually was that of looking at a highly correlated sexual violence victimization as well. We also use the language of unwanted sex when we're asking these questions, so we're never talking about rape or sexual assault, but we're talking about behaviorally specific components that match with those definitions. We are using more of we are using the CDC definitions for these constructs and not a criminal definition of the constructs.
And this is Eileen. That being primary prevention, meaning to prevent sexual violence before it happens, meaning to prevent the perpetrator from getting to the victim. So that was the purpose of measuring perpetration.
Okay, great. Well, thank you. Let's move on to the to evaluating these changes over time. Heather, I think you were going to talk a little bit about that.
Yes. So it's been mentioned several times that school was the unit of analysis and of randomization. Emily mentioned that the surveys were anonymous. So that means that from year to year, we can't track how students change over time. But that's okay, because our interest was in the school. And so our primary analysis was to look at how the schools change over time. We measured that by taking those student surveys and aggregating, summing them together to count for a school how many violent events were reported. And then we used those for our longitudinal analysis. The longitudinal analysis is just our analysis over time. The main thing to take away is that we use the indicator of the interaction of the condition and time as our primary measure of does this work. So what that means is that the slopes are different. So what we hope to see was that the slope for the intervention school would decline in perpetrated events, while those in the control schools would stay the same or really stay the same as the best case scenario. So we expected those lines to cross, and we measured that through that interaction of condition and time.
And we will illustrate that shortly. So now we're going to go into some of the findings, and just so you know, we're going to not be doing all of the findings, but we'll do some of them. There is, if you want more findings on other subject areas, we will have those on the slides are available on the Prevent Connect website just at the end of the slide deck, but we won't be covering all of them. So let's start here and with and I believe Ann, you're going to start by talking about what the definitions were. Ann and Heather, you were about the definitions.
Yeah, this is Ann. We just wanted to really be concrete, so we provided on the slide, I'm not going to read it, but so that everybody could see how we framed the questions. These actually come from a version of NISVIS, the CDC National Intimate Partner and Sexual Violence surveys. So we took the victimization questions and reframed them as perpetration questions. NISVIS originally had perpetration questions, but it does not produce those in terms of estimates. So that's essentially what we're asking. We analyze, and I'm going to pass this to Heather in just a second, but at the very bottom of the slide, it says the response options and the number of times in the past 12 months. Remember, we're asking people in each of the surveys that we come annually to do the surveys, we're asking the students to reflect their experience over the past year, okay? So we're actually using estimates of the number of times that they're telling us that they experience each of these events. So we are not actually looking at rates, but we are looking at the number of events. Okay. All right. So that'll come up just a minute in the very, very near future, because I'm sure someone's going to have a question on that. All right. So our big picture question here is, we're on the right side. Okay. So the question then was, does the bystander training as randomized at the school level, I think we made a big point about that, it's at the school level, and as randomized. So we use the language of intent to treat, which means basically the simplest of analyses. We are not adjusting for anything except school size. And why school size? Because we have different sizes of schools, and it's not fair to compare those without some sort of an offset. So that's really the only thing we're adjusting for. We did one other adjustment that Heather was on the previous slide, but we did exclude mischievous responders. David, I need to look to you. Do we want to talk about that now, or do you want to entertain a question later?
We'll go to that later.
Okay, great. All right, so I got the message we need to move forward. All right, so I am really excited to be able to present this because it's essentially great news. What we're seeing, as Heather described, what we would expect to see if the program works is that over time in the green dot schools, which are so creatively shown on the slide as green, and also a solid line, we see over time, and here's the important word, with green dot implementation, we see a decline. We only really saw the consistent decline in years 3 and 4. And I would like to hearken you back to the first question that we were answering, which was, do we actually see that the program is implemented? And full implementation occurred in the last 2 years of the study. So in other words, intervention year 3 and 4. So this slide shows you sexual violence perpetration. This is our primary outcome. If we lost all power and completed the study right here, this presentation right now, this is the ultimate answer to the question. Does this intervention work to reduce sexual violence perpetration as it is implemented by Rape Crisis Center educators? The answer would be yes. Why would I say that? There are 2 pieces of information for the slide. Bottom of the slide is a yellow highlighted condition over time, and the F-test for the intervention and control. So it's basically taking the difference in the number of events averaged at the school level, and that interaction term, which is the interaction of time and condition, is a p-value that's significant at less than 0.01. It's actually 0.0003. So we do see different slopes, as Heather indicated, such that we see somewhat of an incline or an increase in the controls. It's so important to have a control school because you don't know what's going to happen during the time of the trial. This is 5 years. We actually saw an increase in the controls and a reduction in the intervention. The other thing I want to point to, because you're going to see several slides, is what's presented at the bottom, all those numbers. That is the difference in the intervention minus the control. It's the average number of events. We want to see negative numbers, and we start to see negative numbers when we get to year 3 and year 4, when the intervention is fully implemented, meaning both phases of the intervention are in place, and the confidence intervals both contain negative numbers, which means it's statistically significant for those 2 years. So we're seeing a reduction in year 3 of an average of 130 fewer sexual violence perpetrations, and then 88 fewer sexual violence perpetrations in the intervention relative to control in year 4.
And this is Eileen. I want you to pay attention to the red line as well as the green line. After I got very excited about the green line, I noticed the red line. Which happens if you do nothing, which is pretty scary. So even if you don't choose green dot, do something. That's the end of my comment.
Okay. So
Drug and alcohol facilitated rape?
Yep. So let me just really, this is a short and sweet because we've got a lot to talk about. So in the paper, we provide an analysis for every of the 3 items of sexual violence perpetration, and we do it again for sexual violence victimization. I wanted to highlight the one outcome that is most susceptible, if you will, most public of the 3 sexual violence perpetration items, and that is drug or alcohol or drug-facilitated unwanted sex. And so we do see the greatest reduction. In other words, the intervention works best on this particular form of sexual violence perpetration. Works best, what's my evidence for works best? Well, basically you see the p-value is less than 0.0001, and you see consistently a reduction in 3 and 4, as you did with the summed items. I just wanted to point that out in terms of the particular tactic or the form of sexual violence that we see a reduction in.
This is Heather. Eileen mentioned that they look at the red line. You know, one of the reasons it's important that we have a control group is that if we had just seen the reductions, we wouldn't necessarily know the degree to which we have a difference here. And so things can happen over time. There's variation in schools and there's variation by year. So you can see slight declines or increases as you go along. But the important part is that you're looking at this difference between intervention relative to control schools, and that's really what enhances the scientific evidence of this study is the ability to have that control group.
Right, and the ability to measure what's going on at each point in time, and that intervention minus control difference are both important. We actually did some of our earlier work. We looked at just the difference of change in time in the intervention and the control, and we're actually seeing positive and negative going on at the same time. You can see that from the trajectory of the two different slopes. I'm feeling urgency to continue, so I'm going to go to sexual violence victimization. This is essentially our secondary outcome because we've really met the criteria from the perspective of our funder that we see a reduction in sexual violence perpetration. We additionally saw a significant reduction in sexual violence victimization in the intervention relative to the control. That was statistically significant. The one thing I wanted to call your attention to is that we saw a reduction that was significant in year 3. That's that difference of 167. That's statistically significant because the confidence intervals are both negative. We see actually sort of an increase, a slight increase in that last year. The last year, again, this is measuring at the school level, so there was some tapering off as the intervention was in the last year. People were ready for us to be finished as we read. All right, so I'm going to keep going, David, unless you want to slow me down, to the next slide, which is we're taking a slightly different tact in this analysis. I might need to involve my colleague here, Heather. So we epidemiologists and we public health types, we really want to know a proportion. What proportion of the intervention, what is the impact of the intervention in terms of proportion reduction in our outcomes? So we took the same data and we were looking at the school level, what is the rate, meaning the frequency with which any of these happen at the school level, and we're measuring here just for presenting the sexual violence perpetration. So this is an individual, the rate at which at the school level, the person said any of these things happen. And what we're presenting here is year 0. What's year 0? That's baseline. All the previous analysis, we adjusted for the baseline numbers. But I wanted to give you a sense of that actually the rates were slightly different at the beginning, but again, we adjusted for the differences in the subsequent analysis. So what we see then, very similar to the slides we just talked about, is that in year 3 and year 4, again, the last 2 years when it was fully implemented, we saw a significant reduction, and significant meaning, well, what is the reduction? At the bottom of the slide, the interpretation, which I really like to cut to the chase, is that we saw a 17% to a 21% reduction in the sexual violence perpetration and among the students in the intervention relative to the controls. So a significant reduction in that over time.
Okay, so let's move on to the sexual harassment, and let's go through, Ann, these quickly so we can get to our discussion. There's a lot of great comments there here, but I do want to be able to get to the discussion that here, and looks like we are going to, I lost your picture, Ann, but we will.
That's okay.
Keep on going here. So let's talk about the sexual harassment and run through this quickly.
Okay, so what I'm going to do is just refer you to the slides. Everybody has the slides, access to the slides. So we again present the construct that we're measuring in terms of victimization perpetration. We also do, I want to say one little thing about the measures of impact. We really wanted to look at not only did the event happen, but to what degree did it impact the individual. We could only really measure this in terms of what the victim told us. So the measures of sexual violence and dating violence impact have to do with the individual's response in terms of did this happen to them. If it happened to them, next slide. Oh, next slide, please. All right, thank you. So the measures of impact are again, questions if the person said that they had experienced either dating violence or sexual violence. The middle one is particularly important for schools, and that's why we highlighted it here, because schools are very interested in knowing whether individuals miss school due to violence because they get paid, or they don't get paid if students are not coming to school. So that's why, next slide please, we chose to report in this webinar the findings with regard to the number of individuals that are reporting missing school because of either sexual violence or dating violence. Again, this is school-level analysis. We're measuring the counts by which the number of events that were prevented because of the intervention. So I'm now in the middle of the slide looking at the intervention minus control differences. These are mean events, and we see in year 3 when the intervention was fully implemented, a reduction, average reduction at the school level, intervention relative to control, of 39 cases prevented, if you want to look at it that way. And then in year 4, it was 25 cases prevented in the intervention relative to control, and that borders on statistical significance at the 0.05 level. All right. Okay.
And so, and then just to clarify, there's a question that's been going on, is that indeed, depending on which slide you're looking at, this is not saying that there are no incidents that are taking, there still are sexual violence perpetration events taking place in the past 12 months in both the intervention and the control schools.
Absolutely, yeah. What we're measuring is a trajectory change over time. So what we're doing is reducing the violence.
Right.
Not eliminating.
Exactly.
We wish, but we haven't found.
Great. Well, then, great. The summary of your findings, what you're seeing.
Yes, I'm happy to talk about that. Not to wear everybody out with looking at all the outcomes. You can do that on your own time by reading the paper, which we tried to provide a lot of information, not only in the paper but on the online. Highly encourage everybody to go to the online to get all the data you'd ever want to see on this. But basically what we consistently saw is that the intervention had impact on the range of different, that continuum, the red arrow, the continuum of violence types. Again, I want to call your attention to the last column because that's what we were asked to look at. So we see an effect in terms of a reduction in violence perpetration, in intervention relative to control for unwanted sex, sexual violence, for sexual harassment, for psychological dating violence. We measured reproductive coercion as victimization. We couldn't figure out well how to do that in terms of perpetration. We also saw a reduction in intervention relative to control in terms of stalking perpetration. But we added all the forms together, again, saw a similar reduction there. I mentioned that we also looked at the impact of sexual violence and dating violence, and that's victimization, which is the bottom category. We saw a significant reduction in the intervention relative to control for virtually all outcomes that we looked at, with the exception of physical dating violence.
Okay.
Which is not very commonly reported, fortunately. I mean, that's probably the explanation. Okay. We're on the slide. Okay. So the conclusion is that we see evidence that Green Dot works, and here's the important words here, as implemented by trained rape crisis center educators to reduce interpersonal violence, victimization, and perpetration for the range of different items that are listed here on this slide. I think it's really important. I'd love to have more conversations about what this means in terms of those of us on the call. in how we're going to implement, or how perhaps we're implement a version of Green Dot or other bystander programs in terms of who's going to do it. Because as Kristen mentioned, there's a lot of training that goes with this. And many programs have been implemented in schools in which school teachers are implementing this. So there are real challenges in terms of next steps in evaluation and implementation and evaluation of the program. As it's implemented here is not perhaps how it may be implemented in other settings.
We're actually going to move to those implementation questions. So Eileen, you talk about some of the next steps that you're taking in Kentucky.
Okay, so the trial actually ended in August 2014. We are already doing these next steps. The very first thing we did was to go to the Red Cross centers and have them go to their control schools and ask them if they were still interested in having Green Dot and sharing all the information with them. We did a very large education campaign with all the principals that helped us, and I just want to shout out to the schools right now. Without the schools' collaboration and cooperation, this could not have happened, and they were fabulous. So about half of the control schools actually said, yes, we are interested. The other half said, we're really love you, but we're tired of seeing your face, so thanks so much. The evaluation efforts, we are evaluating as we go, of course. We're not doing, of course, the surveillance right now, but we are evaluating everything we're doing, and we're trying to make sure that fidelity is the same as it was during the trial. We also did a cost-effective analysis, and that's been published as well. It took us a couple of years to get this paper published, and the other one is published for the cost analysis. This is an expensive endeavor in some ways, and in other ways it isn't, because you only have to train 15%, about 15% of the school to get the same bang for your buck. So depending on the size of your school, one or two trainers from a Red Crisis Center who doesn't charge you, which we don't, that's a big, really good bang for your buck. Also want to tell you it's a really good idea to have your Red Crisis Centers do it because they're trained interveners as well. So if they get somebody talking to them about this has happened to me, you have two trainers in there, one can take that young person out into the hallway and make a referral. So that was a really good thing. It happened quite a bit while we were doing the training, and I think it's a really good idea. Schools are doing this, though, and they also know how to make referrals to the Red Crisis Centers. So I think it's both and is a good idea.
Great. Now, Heather, I want you to talk. I'm going to ask you to try to do in the quick minute version of the cost piece, because I do want to get to this discussion about some of the implementation pieces. But Heather, take it.
Okay. So as Eileen mentioned before, there was a shift so that the educators could now provide this primary prevention and be the educators in Green Dot. So we surveyed them on how they spent their time, and what we found was that the overall cost for the entire 5-year period was about $1.6 million. This did not include our surveying and evaluating costs, and it does seem like a price tag, but if you consider that the estimated lifetime cost of rape is $122,000 per victim, it starts to become a much smaller number. I'll also mention the big part of that cost is the personnel cost. Those are the educators who are delivering the training. And really, it's the centralization of the training and coaching that KSAP provided that helps to standardize the delivery and allowed us to provide this across the Bluegrass, so that if we had to add another school, as Eileen mentioned, it's not the cost per student. It's really the cost of, can an educator take on an additional school? And so, that really is a small cost of about $15,000 for the educator plus their travel supplies. And we're currently working on the cost effectiveness piece, which will involve that piece that Ann mentioned with the impact, looking at students missing school and like I said, the lifetime cost of being a victim.
Okay, well, thank you very much, Heather, for sharing this. And I know I'm running through quickly because I do want to get to some of these pieces on the implications. And so the first piece that I just want to highlight is that this is a study that showed that is taking a bystander program, green dot, being with the particular support that, of that intervention, as was seen there, and it's shown that a bystander approach can reduce perpetration of sexual violence, and this is the first high school study that's shown that. We have other studies in the past have shown changes around behavioral intent and even bystander actions, but not showing the reduction in perpetration, so that's an important piece for us to realize. The other piece I think the other piece, though, is understanding what bystander is. And so there's a lot of controversy and discussion of what constitutes a bystander one. And I just want to have a little bit of a discussion with you about, about some of those bystander pieces. And I think some people talk about, and you talked about this at the beginning when you introduced this, and some of the work that like Jackson Katz had done initially around hypothesizing the bystander pieces, is that it was really around looking at changing issues around gender. And so can you just talk a little bit about, because Green Dot is one that does not address gender in the same, it does more of a gender-neutral approach, yet there's other ones, bystander approaches, that have been taking a much more gender approach. So can you just talk about this briefly, Anne?
Sure, and I will be brief on this. One of the issues that we needed to be as inclusive as possible, largely because we are going into the Green Dot, the Rape Crisis Center educators were working with the entire school, and so it was impossible to make this just an intervention for young men. Coaching Boys into Men is a great example of a program that works really, really well because the focus is really men, young boys, in specific sports. That is not what we are trying to do, nor could we have done it because we're really doing the intervention at full level. But they're different intent, and I think that this speaks to how generalizable this approach is versus a sex-specific, if you will, intervention.
But I'd like to get just a little bit from our audience and just think about this. So what's your feeling about bystander interventions, about being gender neutral, advantages and disadvantages to being specific to gender or gender orientation? And just think about, just to get some sense, because I want to just recognize that there are the range of the types of programs and approaches. Green Dot, which was tested here, was one that was gender neutral and getting to be able to reach its audiences, yet there's a variety of places. And, it feels like that we need to reach both genders, so I'm seeing some comments. And there's some different programs that people are doing. I know I see in the description, people that have SLAY, which is a program that was designed for female athletes to complement coaching boys into men, to be able to do both genders, but to do both of them in gender-specific ways. And you get to have full inclusion. There's some of the advantages, and there's a disadvantage. It's easier to, and so I just want to be able to acknowledge that you're being inclusive, but you also, there's loss of certain types of conversations that you can't have when you're not being able to have those gender-specific pieces. And so some people would want to keep gender-specific as an option for moving forward. Some say that segregating genders doesn't work as well. Some people find that it works better, and that they're disadvantaged. And so there's a wide range. But I want to move on to a few other points before we've only got 15 minutes left, and I want to get Mo Lewis to be able to share some of her insights. So the other part, though, that was important to me was that we had to look at the school or the community as the target of change. And a lot of our work often is looking at one as a target of change. And sometimes when we try to create measurements, we then look at a whole bunch of individuals. But what this study has done is measure the impact as the school itself as the unit of analysis. So while there was almost 90,000 surveys done in this, there was only 26 units of analysis that they were looking at to look at the changes within the school. So when you saw the number of incidents that they were talking about, there were a number of incidents on the school level. And to me, this is important because what we want to do is create the culture change, and that culture change is really important to be able to do as we look at it from that community level, or in this case, the school level. Now, Mo, I want to turn to you. You had some other insights, and I think we can have some other comments about insights about thinking about the implications of this study. So, Mo, I want to turn it over to you and have you give some of your insights.
Okay, great. Thanks, David. I don't know about all of you, but I feel really cool about this. I love hearing about research. I always feel so nerdy when we get into talking about the numbers and all of this stuff. It's just pretty exciting. One of the things that I hear a lot from people, especially when a new curriculum comes out or when there is new research, people ask me, they go, okay, which curriculum should I use? Is this the best one? Should I switch to this? I don't know. There's probably a lot of folks right now who are like, this sounds amazing. And it really does. What I tell people is that you really need to do what is best for your specific community. And so looking through this research and through this study, there are some specific things that we can take away from these findings that anybody can use, regardless of what curriculum you're using, what strategies you're using in your prevention, and that's what we'll be talking about next. So one of the cool things that I think came out of this project was that the researchers really knew that folks at the local centers are the experts in their community. We know, and probably a lot of you on here who are preventionists already, you know that you are smart. You know that you know what's going on in your community. You have your finger on the pulse of what's happening, what the issues are in the local community. You have relationships with schools and other community centers where all of this prevention work can really happen. And so this is a great thing that I think this research really illustrates is the strength of being able to partner with folks at local centers. So if you're not from a local center and you want to do work like this, you really should consider reaching out to the local preventionists. And I know, Eileen, you have some thoughts too about why this works really well.
And I shared those about why I think the Red Crisis Centers were, you know, a lot of bang for your buck because they were kind of interventionists and preventionists. And a lot of them wear two hats. They are an advocate at their Red Crisis Center, and they're also an educator. But I want to make sure that folks out there realize, too, that some of the schools are actually beginning to implement. They are taking the training, and they collaborate with the Red Crisis Centers, and they assist them in doing that. So they will come in and consult with them and help them, and that way we're able to get Green Dot out there in a larger way because adding $15,000 per school, that can train an educator at the school, too, not only a Red Crisis Center staff. So I think it's important. You reach a saturation of how many schools you can do as one educator. It really works best with two because it's exhausting, as you can well imagine. But working with local centers is a really good idea.
Yeah, absolutely. So yeah, local centers, those are the people. I come from working at a local center, and I always loved when people were able to connect with the folks at local centers, including me, to say, what are you seeing in your community? What should we really be doing together? So that's one of the key things you can take away from this. The other thing is to look for leaders. So I know we talked about this earlier, that students were invited to participate after being identified by school staff and students as the popular opinion leaders. So not necessarily just the folks who are the most popular or the most smart, but really those people who are respected and listened to by their peers. So in this study, staff were asked which students were influential, and students were also given a survey. So they collected this data from both places to really identify the leaders who could be part of this. So this is a strategy you can think about using in your work too, really asking students, who do you really listen to? Who do you think about? Peer leaders are really effective in helping shift those social norms. So that's a takeaway that you can use no matter what prevention program you're using. And it looks like
I'm going to skip this question because I want to get to the rest of your points.
Okay. Well, we'll just continue. We'll press on. So one of the other key things to take away from this, no matter what sort of prevention you're doing, is that well-trained staff is really important, and this is something that we can see really well in this study. Some of the things were already talked about, but there are a couple additional things that I want to mention. We know that educators who were doing this study and presenting to students participated in a 4-day training prior to the implementation, and then they also had frequent follow-ups with researchers throughout the program, which is great. There were spot checks throughout the presentation, so sometimes the researcher would just come in and say, okay, how's it going? They would watch to see how things are happening. And this helped create an improvement loop, which is something that if you're into process evaluation at all, this is a great way of checking what you're doing and seeing if there are little tweaks you can make, just small changes to make everything more effective as you go. Another great thing is that the educators met monthly to talk to each other. And this really created a kind of learning community that can be useful. It might be something that you can implement in the work that you're doing. It really let people be able to learn from their peers, get advice on tricky situations, do some troubleshooting, and be able to get tips from others who are doing similar work. So you can think about if any of these would be useful to add to the trainings and to the prevention that you're already doing. Having well-trained staff is just so important, and I think this study shows some really good ways that this training was able to happen.
Right. So Eileen, I think that this has actually been one of the challenges in the turnovers. Therefore, we have our little merry-go-round. You just want to talk about some of the costs of sustaining. There's been questions in the text chat about sustaining and some of the challenges that Kentucky faced and is facing.
Well, we invest heavily in our educators, and to go back to the slide before a little bit, I wanted to let you all know that while we were in the RCT, we had our educators actually record themselves. They wore an iPod around their neck the entire time, and we recorded them and checked off to make sure that fidelity was going on across the state so that everyone was saying the same thing. We wanted to make sure that, while we were measuring, that we were measuring the same thing across the whole state. So now we are having real problems with, and I think everyone else that does Green Dot is having these same issues, and we did throughout the trial as well. Being an educator is an entry-level position. We had high turnover. At the time, we had a trainer in-house, but now we don't. And so we are sending our trainers, our educators, our new ones, and we go through them like a lot, to whatever is available. Green Dot is doing training on high schools, which has decreased over time, and it's expensive to send our folks away, and the lodging, et cetera. It's more cost-effective to have them come in, but a lot of times we don't have that many people. So, it's a kind of a give and a take. The sustainability of the training issue is difficult. It creates a problem with us being able to maintain Green Dot in Kentucky. And I think other folks are having the same issue. I do want to make sure that you are aware, too, that we spend a lot of money on the sustainability of just making sure that we're constantly processing and meeting. We are able to bring in our educators from across Kentucky. Like, if you were doing this in Alaska, that would be impossible. But we're doing it in Kentucky, bringing them in every month. They practice together. They talk about barriers that they're having issues with. And it's a constant process. It's practicing all the time, and it's very important that that level of training and engagement stays very high with the educators to make this work. We also have our board heavily involved. One of our board members actually chairs that PIC. You heard that term. That means Program Implementation Committee. The folks that serve on that committee are the educators. All of our board directors are also trained in Green Dot, and as well as everybody in the center. So we have Green Dot rape crisis centers to make sure that everybody knows and can pick up at any time, to have kind of the B team, a deep bench. So that sustainability is a big issue for us, and Green Dot, et cetera, is aware of that, and I know that other programs have shared that with them as well, other states.
Well, thank you for sharing this, Mo. I'm aware that we are in our last 3 minutes, so Let's do, but your point is, you still have some important points that I want to make sure you can get to.
Well, I think this is the most important one. So really you want to check for fit. We know that it's important for any sort of prevention work to be reflective of the communities and cultures that we're working in if we want it to be effective. And so depending on what sort of curriculum you are using or want to use, we really might need to do some adaptation to make it fit. Even when something has research behind it showing a program's effectiveness, it doesn't necessarily mean that you're going to get the same results, because we know that every community we're working in is different and will have different needs. So this is a really big takeaway. You want to consider the demographics of your community. You want to think about race, sexual orientation, socioeconomic status, if you're working in an urban or rural area, and also really considering the specific needs of the local community you're working with and what things are going on within the community. So what I want to offer to you is that there are a lot of ways that you can adapt already existing programs to better fit the needs of the folks that you're working with. So if you are using a curriculum and you're not exactly sure how well it fits your community, feel free to reach out to me, reach out to other NSCRC staff. I'll put the email in the chat box, but we can really help you work to make those adaptations without losing program fidelity. Huge takeaway.
And this was our cute picture of balancing fidelity and adaptability that you want to be able to keep, and that if we had more time, we would actually talk more about the essential program elements and preserving those essential program elements and being able to move forward. So with Green Dot, there were many components, training of the 10 to 15%, well, say here the 13 to 15% of the population, selecting your popular opinion leaders, delivering all the program components, adhering to the scientific basis, and making sure that you have that skill and delivery. I know, Kristen, you were talking about some of the messaging key. There was also key messages, essential elements of messaging, the 4 messages. Do you want to just briefly say that, Kristen?
Yeah, absolutely, and I'll keep it quick because I know we're up on time. But so essentially at Green Dot, and for anyone who's doing any kind of bystander intervention, anything, to be considering, I think, from this and kind of next steps, is what are the active ingredients, like what are the pieces of the Green Dot training or bystander intervention in general that are actually responsible for creating these changes. And also thinking about fidelity, which has been spoken to by a few different people, about what kind of fidelity or what degree of fidelity do we need to have, how important it is, and how fidelitous to the original model, whatever that original model may be, do we need to stay to in order to get the kind of results that we want. And so just kind of quickly, or for you all as practitioners, for us to be thinking about that as a field, like what are those essential ingredients? How much can it be generalized to other issues, et cetera, and so to be considering some of those messages as well.
Right, and then I apologize for having to rush through here. Mo, I know your point is we have to keep on measuring the impact. What this study did here was look at Green Dot. This doesn't mean that all bystander interventions will show a decrease. All bystander interventions will lead to a decrease of sexual violence perpetration, but what it did do is that the Green Dot, as was implemented in this study, did demonstrate that in taking place, but it's important to realize that then there's also shifts in even Green Dot, and now moving from Green Dot 1.0 to 2.0. So we want to continue that work, and we'll continue that discussion. I want to thank all of our presenters, Ann Coker, Heather Bush, Eileen Reckenwald, Kristen Parks, and Mo Lewis for joining us, and thank all of you for being able to do this. I'm sorry I wasn't able to get to all the questions, but this is a conversation that we will continue to have. All of this information and more are going to be available. If you download the slides, you'll get more data around other outcomes, and there's a lot of great resources shared in the text chat. So thank you all for joining us on today's Prevent Connect web conference. This concludes. I'll keep the text chat open for a couple minutes, but this will conclude the audio portion of our web conference. Thank you all very much.